Well, hello and welcome to our webinar on Jorie Healthcare Partners and the exciting work that we're doing to revolutionize healthcare with their innovative use of AI technology. We are absolutely thrilled to have with us our speaker for today's webinar, Sal Lowe, who's the CEO and co-founder of Jorie Healthcare Partners. So why are we here? Well, to chat with Sal about all the amazing things that are going on at Jorie. Our subject matter overall is how Jorie took the lead on AI, end-to-end revenue cycle management technology. And don't you know, but I love technology, and I'm so looking forward to hearing from Sal. Know that we will have a Q&A at the end after the interview. And if you want to do that, you can switch gears from going from your hometown to putting in questions as we go through, and we'll get to as many as we can as time allows. So go ahead and drop those in there whenever you can. Also know that we're going to be dropping in a few polls along the way, and we'd really appreciate your involvement on those. Thanks so much. All right, let's go. So Sal is a true visionary in the healthcare industry. He has a deep understanding of the challenges faced by healthcare organizations. Sal's healthcare experience includes designing and building hospitals and clinics, which gave him a healthcare provider's perspective. Sal is the driving force behind Jorie Healthcare Partners' AI revenue cycle management automation, which has been making waves in the healthcare industry for its ability to increase efficiency, accuracy, and of course, revenue. We are incredibly lucky to have Sal take some time out of his schedule with us today, and I know that he's got a ton of valuable insights to share with us about the future of AI in healthcare and the work of Jorie Healthcare Partners. So if you will, please join me in welcoming Sal to our webinar.
Well, all right. Thank you, Grant, for that great introduction. And I appreciate the invitation to come to this webinar and be able to reveal some of the best kept secrets in automation in the healthcare industry. And so our main topic here is truly what we are doing to dedicate our organization to improve the financial well-being of our hospital systems using technology as the first source to go after the myriad of rules that the insurance companies have to address back and forth with the provider. Long story short, this is $1 trillion issue in the healthcare space today that's being spent every year, multi-trillion dollars. On top of that, 20% is being lost in regards to the administrative burden of cost to collect. Imagine coming in and trying to figure out, are you eligible, not eligible based on your benefits, and is my insurance going to pay for this or not pay for this, and then delays in regards to getting authorized to get your MRI done, and then potentially your most critical time when you need a surgery, that is your insurance going to cover it? Long story short, is this an age-old problem that's been through manual process? And what I'm going to try to share here with everyone is the idea of how technology can impact the bottom line for the institutions and overall improve patient care. So thanks, Grant. I'm happy to answer any questions that might be coming from the audience, but looking forward to this discussion today.
Cool. Well, thank you, Sal. I want to start out asking you about the full story, and we've got a whole bunch of topics here to go through. So I'm going to start right now about end-to-end cycle revenue cycle management technology. So how did you first develop the technology? I mean, how do you start something like that?
So let's first talk about the definition. So many of you may not know what end-to-end revenue cycle is. So revenue cycle is the description in healthcare on how you bill and collect today. To basically the benefits that you have that you pay each and every month for your health insurance. How does that translate to the collectability and the payment for that health from the benefits of that health insurance? And so we created what we call an end-to-end revenue cycle management technology. What does that mean? Instead of a human trying to keep up with those rules when you give them your eligibility card or your benefits card, Now we have technology that can actually act like a virtual human and go in and out of the insurance portals and address all the myriad of rules. This is what's called end-to-end revenue cycle management technology. It's really doing everything from the front end to the back end to answer any questions insurance companies have without any humans. And so this is a technology built to automate the human. So how did we develop this technology and how did it start? Well, you have to go back to our organization. We're a healthcare organization by trade. So we built hospitals, surgery centers, clinics, et cetera. In the last 10 years, we started automating a lot of our process to address the same issues that hospitals are having today, which is the manual process and the inefficiencies that is causing losses. And that could be upwards of 10, 15, and 20%. So imagine that on $1 billion system. That's about $150 to $200 million a year that could be better spent for patient care. And in addition to that, it can mean a lifeline for some of these struggling hospitals. So when we started this way back when and developed it 10 years ago, in the last 3 years, we realized that we developed a technology that was light years ahead of itself. And that technology was the automation that we're going to showcase or talk about here today that found the money to save hospitals literally tens of millions, if not hundreds of millions of dollars. When we found that, it's like finding the solution to an age-old problem that was causing billions of dollars in losses.
Very cool. So what does the technology actually do?
So think about it. It actually does the work of a human being that has to bill and collect for you, but at 1,000 times the speed, at 1,000 times the accuracy, to be able to affect its job, 65 claims in an hour, where a human would have to take a whole day to do that same amount of claims. So think about all of those thousands and thousands of rules insurance companies have. Our technology can actually memorize all those rules and then go from location to location to get all the information required to submit a claim and accurately get the insurance companies to pay the claim faster. So what it does is it mimics a human. What the results are is that it gets money back to the healthcare providers, which is money that they earned, money that can basically bring their system back into a healthy state.
Very cool. That's got to be a good thing in healthcare. So we've been hearing a lot about AI technology. I mean, it seems like it's everywhere. What's different about Jorie's AI? How does it compare?
That's a great question, Grant. And, we have a lot of organizations basically trying to sell automation into the healthcare space. And there's a lot of clutter out there. And I think that, when we came out just 3 years ago, it wasn't just because we wanted to join the game. It's because we wanted to provide a solution, and we didn't release our automation until we felt it was the right solution to find savings. So let me give you these differentiators. How did we find those savings? Well, because we're a healthcare entity by trade. So if you're trying to talk about technology that understands healthcare, unless you ran a healthcare entity, how would you know? You're going to ask, what is an EOB? What is a medical necessity? What does all that mean? Well, we already built that into our technology because we're healthcare providers. Secondly, Grant, we are also a revenue cycle organization. So we know how to bill and collect. So we have over 1,400 people globally, and we are one of the experts in regards to why things get denied, how to bill and collect. The third, but not least thing, is the idea that we're a global cutting edge technology company, that we build our platform through the latest technologies like Python platform, rather than what everyone's doing out of the box. So long story short is when you take these three things combined, it separates us out from everyone because we created a solution and we weren't looking to sell a product. By creating this solution, we found what? We found savings. And when you find savings, you're the best friend of the hospital. And we don't want to be a cost. We want to find savings to solve the problem. And that's where our technology differentiates us from everyone. No one else has this type of technology that actually takes action and finds those savings. Just call it a savings bot for healthcare, because it's not a transaction bot where you're going to buy a widget, where other organizations created technology to address a widget. That's not strategic. Our strategy to do an end-to-end solution to find savings allows our technology to learn and get ahead of the competition.
Fascinating. Well, I know we've got a couple poll questions as we started with today, so I'm going to step aside here for a second. And Derek, let's get one of our first questions up for the audience. And if you guys would jump in and help us. So how does your healthcare organization currently handle revenue cycle management? We would love to see some votes there, if you guys don't mind. All those wonderful people that joined in earlier, go ahead and click the buttons that should be showing up on your screen automatically. Give you about another 10 or 15 seconds to jump in. They don't let me vote, Sal. I was going to vote for all of them. So,
wow, this is amazing. You know, the amount of participants here on this voting process.
yeah, I thought we were going to hit 100. We're not very far off. So,
Mhm.
manual processes and traditional automation are kind of neck and neck there.
Mhm.
AI is way back there. So that tells me you got a little opportunity. And then we got some other sitting there. So that's great. So that gives us a little insight. So let's do one more while we can, and then we'll talk about these, Sal. Let's get the second poll question up, if you would, Derek. This is fascinating stuff. So in your opinion, what are the biggest challenges faced by healthcare organizations when it comes to revenue, my goodness, revenue cycle management? We've got some inaccurate billing, some slow payment processing, difficulty tracking claims. Oh man, the last one, complex insurance rules. I just had surgery about 2 months ago, and that's ridiculous stuff right there. So get a couple more answers in here, another 10 or 15 seconds. We should have some Jeopardy music or something like that, right? Well, there we go. Complex insurance rules led by a large margin. We got some inaccurate billings, some slow payment, and some difficulty, but yeah, complex rules. So thank you all for doing the poll. We really appreciate it. So Sal, the last poll question poses a great question. There's a great challenge faced by healthcare organizations, and automation technology can help us to overcome these challenges and improve the revenue cycle management. So in your opinion, what's the biggest challenging thing right now facing healthcare organizations when it comes to that cycle management? Or if you wanted to talk about those bad rules, if you want to.
Yeah, absolutely. I think you pointed right to it, Grant. You saw the polls. It's the complex insurance company who really understands healthcare, even from a layman perspective. What am I actually going to be having to pay for in regards to that? Because the rules are so complex. It's all our fault. The provider and the payer. Remember, someone's trying to hold on to a dollar here and there, back and forth, and that complexity has caused this problem. And the ability now to address that complexity utilizing a technology is really the solution. When you ask about the biggest challenge facing the healthcare organization, that leads to the financial crisis we're having today. You have unsustainable healthcare market spend. You've got post-COVID situation. You've got hospitals that are struggling, eking a 2 to 5% revenue off of $1 billion, which is scary. The long story short is the financial impact for these hospitals are struggling and they're facing challenges that they've never faced before, including hiring people to even do this revenue cycle work, including debt covenants that they would violate what they owe the banks in terms of their debt, because they can't afford to add more resources around the collections and the billing. So this technology will at least give that piece back to the healthcare system to improve that quality of health in their financials. I think Grant, this is going to be the most impactful technology for the state of healthcare from a finance perspective, so that healthcare systems can continue to operate before they can even provide quality care. And that goes hand in hand.
Wow. It's kind of ironic that they need to hire more people to get the billing done, and they're not allowed to hire more people to get the billing done. Something wrong with that.
That's right. That is right.
So is anyone else providing full end-to-end revenue cycle management automation? And maybe who are the major players in the industry?
I think in this topic, Grant, we stand alone. We basically are the only end-to-end automation revenue cycle. And let me tell you what that means. Well, a lot of automators claim they have end-to-end, but remember, they purchased or built little bots. It wasn't strategic, it was transactional. Basically a widget that we needed to fix a problem. So they bought these widgets for eligibility, payment posting, denial management, and then tried to connect them all together to create what they call an end-to-end solution. And of course, they were not going to be talking to each other. When we created an end-to-end solution that continued to learn and improve itself and take action, that's the key, take action. To be able to do something that it learned from the front end of eligibility to make sure that payments don't get denied on the back end, and understand how to improve that because it understands medical necessity and understands why this patient will not qualify for an overnight stay at a hospital. How would you like it if you were the patient that didn't qualify for an overnight stay at the hospital, right? So the bottom line is it required a note that said you should have documented comorbidity like smoking or obesity to qualify for that payment. Well, our bots maintain those rules. That's really the end-to-end revenue cycle automation that we provide that no one else is providing today.
So kind of a note from your mother thing, right? So what are other companies doing different? Is it just the bots that totally set it apart?
You know,
bots?
well, you know, when companies, again, when they came up to do this type of technology, is because the buzzword came out and said, we need automation, we need technology in healthcare. So a lot of organizations tried to fill the gap and said, tell me what you want and I'll try to build it for you. Okay, so when they do it that way, it's almost a hit or miss. When you build it, is it really what you wanted? Okay, right. So when we did it for ourselves and we created a solution, a strategic way to implement technology, forget about the transactional way because that doesn't really save money. Okay, let's say I created a bot that did just status checking. Well, that's just a push button automation. Any human can do that. And I'm going to charge you for that. So every time you push the button, I'm going to charge you for a bot. Well, why couldn't I have a human just do that? That's transactional. When I take strategic and I look at end to end and I learn, that's the difference in what Jorie is doing. That truly sets us apart, Grant.
Yeah. So how do you see the role of automation technology evolving in the healthcare industry? And how is Jorie Healthcare Partners positioning itself to take advantage of the developments?
Well, absolutely. So you know that right now we live in a world of fee for service. What does that mean? When, you know, for every procedure you do, there's a cost, there's a price, you pay for it. Okay. And you bill and collect based on those charges and whatever the insurance company would negotiate with the provider. And the balance is your piece, what the patient has to pay. Okay. Where I see this going is it's going to close the gap between the payer and provider. Because the payer is going to keep the way they're doing things because the provider can't file the claims fast enough and they can't accurately file it. So why would the payer change anything when they could just wait to keep the money because it missed timely filings? Okay, but when I close the gap utilizing automation to address the myriad of rules, then it actually closes the gap between the payer and the provider. Then we lend towards what people call it population health, value-based care. This is outcome care. This is where the technology is heading to identify all the data points in your disease state. Oh, by the way, you have diabetes. But now the automation is going to check on all of the reasons why you have diabetes, look back and forth and find you like the needle in the haystack. You're the one person that we need to talk to because your numbers went off the charts and you need to see your doctor. But instead of having people go through all of that, our AI technology could do that now. You'll see AI evolve into such a supercomputer that is going to go beyond into the patient care. You're seeing it also identify cancer way ahead of cancer. Right? Where our space is in the financial side. We even work with the banks We even work with organizations for the financial health of the business, from the CFOs, to make sure that we are monitoring how the billing and collections is today to impact the finances through automation.
Very cool. So how does the use of AI technology then in the revenue cycle management benefit both healthcare providers and the patients?
Well, people ask me this question all the time, and it's just all about the money. Are you just collecting faster for the provider? But imagine a patient experience walking through, right? The provider's easy. We know we're going to impact the provider with faster eligibility, get your money in faster, make you more money. But how does that impact the patient? Well, here comes the patient. They already know their benefits are taken care of. They have full transparency of how much they owe. And now they're going to be taken in. They don't have to worry about if their MRI is paid for by the insurances, because our bots ran it 24/7 and even picked up a last minute add-on that basically your doctor said you got to come in right now. But I don't know if my insurance covers it. The bot picked it up and oh, I need authorization from the insurance company. The bot automatically got authorization for you in the insurance company and submitted any supporting documentation. So what does that mean? That means this patient's experience through the most difficult time, perhaps going into a surgery, is now they don't have to have an additional worry of, is my insurance covering this? And at the same time, they're being provided care faster when needed. The worst thing that can happen is be turned down and delayed. And what happens when you're delayed, when you're needing a surgery? Things can happen. Your health could fail in between. And this is what the technology is going to do, is going to streamline the continuity of care for the patient.
Fascinating. Well, I want to get another poll question up because we need to figure this one out. So I've got another poll question. If you all would jump on your mouse clickers there, and in your opinion, what is the biggest potential barrier to the widespread adoption of AI technology in revenue cycle management in the healthcare industry? How do you guys see that? What are your opinions at? Cost, lack of expertise, concerns about safety and ethics, resistance to change? And I could hum the Jeopardy tune, but I won't. So we'll give you guys another 10 or 12 seconds to go here. Biggest potential barrier. Resistance to change. Well, there's no surprise there. Yeah, really. We all want it changed by somebody else, to do it by somebody else, to happen to somebody else, right? Thank you guys for that. We really appreciate it. So let's get another one up there. In your opinion, what percentage of healthcare organizations currently use AI technology in revenue cycle management processes? What do you think? What's out there right now? All righty, here we go. Drum roll. Okay. So I wonder how close these answers are to reality. We got, most people are thinking it's 10% or less, and then maybe as high as 25%. And I think we've got a slide. Do we have a slide on that, Derek, to put up about the survey from Alpha Health? If not, we can go on beside it. The survey
Right there.
has.
No, it's okay.
Are we seeing that one?
Yeah, no, it's all right.
So Derek, he was trying to compare the percentage of the actual poll, and I think that graph I could talk about that really quick. It looks like 0 to 10%. Basically is the significant winner in regards to that. Not a lot of healthcare entities are using automation, and I think that's profound, because when I speak across a lot of these presentations with keynote speakers for major institutions, they talk about how to improve revenue cycle, and they still talk about the manual process. They talk about recruitment, training, and auditing to improve revenue cycle. So Grant, I think those numbers that you saw in the polls are pretty spot on.
Yeah. Yeah, it seems to reflect that. So let's move on to some case studies on how Jorie has helped healthcare organizations improve their operations. And then, of course, all that helps with financial performance. So, can you discuss the potential for cost savings and improved financial performance that can be achieved through the implementation of AI technology in revenue cycle management?
Oh, it's huge. That's why we're here.
Mhm.
When we are, imagine this, and you talked about, even it's going to kind of go back to that poll question where there was what you call resistance to change, but I'm able to break that resistance to change where I'm getting billion-dollar health systems to sign on for those cost savings. And those cost savings are anywhere between 5, 10, 15 to 20%. And whether they believe me or not, okay, I will showcase them within 6 to 7 months how automation should be able to win this money for you. Okay, because just think about just the logic of it. 65 claims in an hour versus 65 claims in a day, accuracy at 99% and productivity at 1,000. So when you have all these myriad of rules, is there money going to be leaked there? And that cost savings is going to be found on that and improving that financial performance. And the way we've been able to go into these billion-dollar systems, when I talk to the CEO and CFO, is to talk to them strategically of going after these cost savings from an implementation standpoint of automation, not to go into selling a widget. Otherwise, they would just said, hey, go down to our revenue cycle staff and ask them what they need. And I will sell them a widget down there. But when I'm talking about the automation as a strategic implementation to find these cost savings, that's a discussion with the CEO and CFO to transform their entire revenue cycle into this type of automation to find what? It could be $100 million sitting there off of their billion-dollar system. It could be a matter of $100 million hospital that's eking out to find $5 to $10 million to be able to save their hospital.
That's a lot of money sitting there, isn't it? So can you
It's the biggest
provide,
spend it's the biggest spend in the United States,
right?
Grant. It's the
Yeah.
biggest spend, trillions and trillions of dollars. Everyone knows it.
So what they used to say about military spending, wasn't a trillion here and a trillion there, and sooner or later you're talking real money.
It becomes like so surreal. But
Yeah.
at this point, this is where we're at, and unfortunately, in our healthcare spend. And so any bit of money I can bring back to the healthcare institution is a positive.
Absolutely. Well, can you provide any case studies or success stories of healthcare organizations that have implemented the Jorie Healthcare Partners technology?
Yeah, absolutely. Obviously for us, one of our case studies, and I don't know if you could pull this up, Derek. So if I'm Derek is sharing a screen over here. In this example, we will call him Dr. G. Dr. G is a live client of ours. Dr. G is experiencing a heavy denial rate in the front end of eligibility. About, I'd say 10% of his cases are being denied right when they walk in the door. Dr. G, if you look at the third bullet point, and Derek, if you would just cursor over that, seeing the third column on the top, there you go. About 4,000 patients a month Dr. G is seeing. This is a small group, and they have also surgical centers. If you go 2 bullet points down, he's using 8.2 resources or people just to address denials. And when we used our bots, it only required 3 people to do that workload. Overall, the savings was 38,000 a month for just a labor, but that's not what we were about. If you look at the middle graph, we were about finding the solution and fixing the problem. So when you see the middle graph, you see the vertical line, and the vertical blue line represents the date we started in September 2021. They're experiencing a 10% denial rate here. And as we went further down month after month, it dropped all the way down to 3%. The labor model alone saved them $466,000 for that period of time. But the big win came from, if you could share the next screen, Derek. Okay, here we go. So here's a summary. 66% drop in denials. This is only because the technology is able to memorize and address all of those rules on the front end. Now it will be consistent in that at the highest quality possible. Your AR days, when you talk to the CFO, how fast am I getting my cash? And if the longer it takes out to go out over 120 days, you're going to write that off. 18 days is now when you're collecting your money. When you're talking insurance in general, it's like, well, 45 days, maybe 60 days, 90 days, that's generally the accepted norm. And now when we're able to collect within 18 days, cash flow is key here. A 3% denial rate, 22% drop in AR days, 9 to 10% of denials going all the way down to 3%. This is where the money is going to be found, and that's just on the front end. And you could exit here, Derek. We're now going to be able to do stuff like short balances missed, modifiers that miss, timely filings, medical necessity. All of these things add up, and they add up into the thousands and thousands of dollars per claim. Our bots zeroing in and finding each and every penny for the provider. Grant, you're on mute, sir.
Yeah, thank you about that. I was trying not to clear my throat over you. Sorry about that. That's fascinating technology, and to see that kind of a growth in drop in expenses over what was a year and a half or something like that.
About a year. Yeah,
pretty amazing.
Starts off in about 7 months and then goes out a year.
So we got a couple questions coming in through the audience here. What role do you see for AI technology in the future of the healthcare industry? And how is Jorie Healthcare Partners positioning itself to take advantage of the developments?
Obviously AI technology will be an integral part of how healthcare is performed. It's not going to take over doctors, although ChatGPT just passed the boards, right? The medical boards. That's just mind-boggling that a computer passed the medical boards. But it hasn't done surgery yet, so
Yeah.
we'll see. So AI technology is constantly evolving. It's going to find diseases and predict it, not by just a human eye, but it'll predict it through algorithms and understand that. Oh, by the way, and they've already solved this. Like, you have a high chance of having breast surgery based on a CT scan or mammogram we did, basically, 3 years ago. Okay, so the AI technology in the future of the healthcare industry is going to be quite impactful for the health of the human being. And when we're looking at the part that we play, again, we play the part of the health of the financials of that system so that it can provide and grow AI throughout the entire continuum of care. Last but not least, our AI, even though it's in the billing and collections, just think of it. Everyone has a code. Everyone has a note that describes what that code is for that specific procedure. And then there's a price attached to it. Usually that's just used for billing and collections. But now combining all of that data for the pool of data that's out there to identify a disease state, that's what we're talking about, the future. Jorie Healthcare has been really privileged because we are the implementation of this automation for Walmart Health across 4,000 to 5,000 locations as their revenue cycle provider. And where I'm salivating over that, and it's not about the money, honestly, it's about the data. All right, the millions of patients that I'll be able to analyze their disease states, and that's where the future of this technology is heading.
Okay. Sal, I saw some stuff on the website, something about the overall system can be looking at things to learn something. So what the system might be learning over here can help another hospital over there. Did I get that right?
Oh yeah, absolutely. The bot, we think about a bot like a human, but the in reality, a human can only do one at a time, where a bot could do 1,000, 10,000, 20,000 at a time. So its ability to understand what happened here versus there and pick up its knowledge base, that's what makes it a superhuman, right? And so we might be looking at why your disease state is progressing or why you're being denied from one location based on information we got from other health systems across the board, and it enhances that collaborative to drive a better action on the condition of care, and as well as how payers are treating the ability to pay for that service. You may know that you're getting paid $1 amount for this region, but at the other dollar amount, they're paying you twice as much. So even having that understanding of where those discrepancies are in the healthcare continuum is quite important.
Yeah, absolutely. I've got a couple questions here left, and I want to make sure that the audience has an opportunity to pop some more in there. Let's put Sal on the hot seat if we can and get some more questions in here. Let me see. Here's how would your technology work with financial institutions who are working with healthcare entities?
Wow, I don't know who sent that question out, but I need to talk to you because that's pretty insightful.
Oh, okay.
So think about it. Think about where the money is going from the healthcare institutions. They go to the banks, right? So the banks have what they call lock boxes for these healthcare institutions. And the lock boxes basically it's a gatekeeper for where all the money is sent to from the insurances. And there's literally tons of checks there for they call EOBs, and they're all being sent into these lock boxes, and remittances are all being sent to these lock boxes. So right now they have to manually process this and say whose money belongs to who, just like any bank does. They split up that money, and so imagine that this is just part of our healthcare automation, and the banks are still just trying to figure out healthcare. We call that side payment posting. So our bots can do and transact that at a fraction of the cost, and allow that as part of a continuum to make sure that the bank is providing that service across the board. Now think of the impact from the financial institution and for our organization. One, it cuts their costs and gives them this technology, brings them into the healthcare field and provides that service to their providers like the hospitals. The other is we are able to plug into all the hospitals by utilizing the bank as the go-to funnel to drive that, because they trust in Jorie and what we've done in that automation space. And so by doing that, we're able to now, from one bank to many hospitals, transact at least one piece of their revenue cycle. Now we're working with their treasury department to do a little bit more.
Cool. That'll be fascinating to see when we get that out there. So are hospitals beating down your doors asking for this technology?
You know, we have at least 4 or 5 hospitals or health systems talking to us on a Zoom call like this every day. We have 3 billion-dollar hospitals every month that are close to contracting, and most likely one will close every month, and to give us what we call an end-to-end opportunity to do a whole solution. Okay, because the reason why this is compelling to them, because when we come in and we are able to undercut the market by our low percentage rate of collections, because we use automation, we take the risk off of them finding those savings, because we immediately cut their cost to collect. So imagine if you're a hospital and you're struggling with collections, and I said, well, I'm going to do it for half the price, but I'm using my technology to execute and find the savings for you. Now you don't have to take a chance on those savings, and I'm not going to charge you for those savings. At the end of the day, it's a compelling reason to try the technology.
Absolutely. Sure. So there's, from my surgery last couple months ago, there's a specialty for everything, right? I mean, there's got to be a slot. Does this work across the board?
Sure. You know, before, when you'd have to have humans, you're going to have to go, you're going to have a special talent for each specialty. When you did regular manual revenue cycle, you go, what's your bench strength? What that means is, how many people do you have on this system versus that system, so we could have the experts? How many people are you doing for ortho? You know, how many are you doing for neuro? Or, you know, so you're talking about the numbers of people that you have experts on that understand that specific rule, where the bot's ability to go from service line to service line and understand all the rules, because it's a computer. And that's where the game changes, because the bot has the ability to not only do the role of a human, but be a superhuman, super memory multiple times at 4 or 5 locations, 10 locations. We're doing a 200 location system right now, and we're going to scale it across 200. And they were acquiring other hospitals and surgery centers and clinics with different electronic health record systems, different systems altogether.
Wow.
The bot was an expert on all the systems to bring that all back into
so
one.
Tying this back to earlier, you said about, hiring somebody to come in. It's not even hiring somebody to come in. It's hiring someone that knows that specialty well enough to actually be effective.
Correct. Now you're finding that needle in a haystack person, and yet the big challenge today in healthcare is trying to get people in general. I
Yeah.
talked to the healthcare system and said, we were hiring people fresh off the street that didn't know healthcare, and we would train them up only for them to not last and quit on us. And
Ouch.
so the ability for the bot to ease that burden and bring on an expert specific to your industry, because it's an expert on all industries. How could that be? Again, it's a computer. There doesn't have to be an expert on one. It could be many.
Right.
Long story short is this bot will pick up your rules just like you trained a superhuman, and becomes one of the most valuable employees you'll ever have.
Fascinating.
24/7,
Right.
24/7.
No coffee breaks, no
No, exactly.
PTO, right? Yeah.
Yeah,
So
you can fire a bot easily,
Right.
easily, but humans are hard to fire.
Right. So Sal, here's a tough one for you. How difficult is this to integrate?
Well, you know, that's what we considered before we even launched it. If it's going to take us a year to onboard this and program the heck out of this bot to understand, then we're in the wrong business. You know, healthcare institutions need this now, and they can't spend a lot of resources hand-holding you through trying to teach you healthcare. So our bot is already fully programmed to understand healthcare and run automation back and forth to answer the insurance companies. So it only takes the last 25%, which is the rules engine. This is your specific healthcare institution. What are your rules? So just like you're training a new employee, like, when do you want to flip balances to your patients? I need to see your contracts so I can understand your contracts. And we program that into the bot. Then the bot executes the rest from there. Okay, so long story short, 4 to 6 weeks for us to get a deliverable. Probably the shortest time frame for onboarding than any other institution.
Wow. So lower interruption and all that kind of stuff. So how about this one? Can you describe some of your most, or maybe the most successful applications of this automation?
So there's going to be 2 of those. One is that we are going to be utilizing in the VA in a major way to save them about $150 million off of $1 billion system. And that's going to be a very impactful dollar value to the VA. Where I feel is one of my best unsaid success stories is I'm working with a hospital that's a rural hospital doing about $150 million a year, and it's struggling whereby it is very marginal, maybe eking out 1 or 2% and sometimes negative. And they have only I'm trying to remember 8 to 10 collectors to try to collect $150 million a year. When I analyzed what their collectors were doing, they were just doing status checking. That means any kind of denials, they were going to let go and they're going to write that off. So they're literally losing tens of millions of dollars, basically not able to collect. So I said, why don't you just hire people? You know, I know technology will help you, but you know, God's sake, hire some people.
Yeah.
Well, they said, Sal, we're only on this margin, and after COVID, we're going to violate our debt covenants, and the bank's going to call our loan if we spend another dime. And so when they do that, they have to sell some assets down the road to improve their balance sheet. And it really is a vicious cycle that leverages their future, and that hospital is going to close. So my impact to that is to provide them this technology so that they can ease the burden. Instead of hiring people, I'm going to give you some super bots that's going to bring your cash collections, because it's sitting in your AR today. I can look at your AR 30, 60, 90 days. And if I see over 20 to 30% over 30 days, I can win for you. It's sitting in your AR. That could be $10 million. You're eking out and trying to earn $1 to $2 million. I've got $10 million minimum sitting in your AR. So when I can impact, you said, what is my best successful application? One could be for a large health system, and there's many of those. But really the most successful ones is when I can turn around a hospital that's struggling in a rural community and make them win and be whole again. I think that says a lot of things of what technology can do to empower struggling health systems.
Yeah, very good. So we just had a question come in. You're doing all this stuff, and I'm going to have to buy, 1 million new computers and hire all these software programs. How much does this really change in our system?
Well, that's That's a really, really great question. Again, we're trying to address the least disruptive way. People don't know how to buy a bot. Is it going to change my system? Oh, it's going to be IT is going to be required, right? If it's IT is going to be required, I'll put you on next year's schedule. This so
Right.
so when so when the bots are implemented, we did it in a way that it acts like a virtual human, because we didn't program it for any one specific system. We programmed it for the human administrator trying to bill and collect. We programmed the virtual human administrator trying to bill and collect. And by doing that, does your biller and collector change your system? No, it works on the outside and logs in and starts doing its job. The bot's delivered through the Microsoft Azure cloud and starts entering and starts submitting the claims just like a virtual human. And it doesn't disrupt your existing EHR. No software is loaded. The only thing that we're plugged into is we are plugged into over 14 insurances directly. That's more than Waystar, that's more than Epic, where we plug in directly through what we call our API feeds, so our bots can get a more accurate eligibility from the insurance portals like Blue Cross Blue Shield, United, Aetna, and 1,400 more on top of it.
Wow. So what role will APIs play in the future of automation, and how does Jorie address this?
You know, I think that the API feeds, having a direct connect into these systems to find those pools of data, will allow us to report these successes. And our ability to, when we talk about API feeds, Grant, we talk about a direct connect into the databases that house the information that, like your healthcare record, et cetera, so that we can manage and help you get to your care faster. I think that as we gain more and more of that, I would say open source ability to do that, the more capable we are going to be as humans to really leverage technology for the betterment of our population. Last but not least, all of these pools of data are all in different locations. Epic have some, and the other organizations have some. Mayo Clinic has some. But when you win in Walmart Health or other organizations, you can help Walmart basically because they have what? They have a giant pool of data that allows us then to assist utilizing our automation to identify the patients that are in need. Then I don't have to go look for data anywhere else. I could just go and address the pool of data for Walmart.
Cool. Well, Sal, thank you. We're going to go ahead and close. We're getting close to our top of the hour. We want to make sure we're respectful of everyone's time. Thank you all. Thank you first, Sal, for all that fascinating information. That's amazing stuff. Thank you all for being here today. Sal shared amazing stuff with us. If you would like to increase your revenue with this truly amazing end-to-end technology, Derek's going to share a scheduling link into the chat window so you can book your live demo. Now, this is a live demo. It's not something recorded. So there it is in the chat box. Please grab that, and you can have that to share with your friends even, right? We really appreciate it. And by the way, this webinar will be made available via the Jorie website and also our YouTube channel. And when you do get time, please check out Jorie's social media for the latest Jorie news. Thank you all yet again for your attendance. Thank you for watching. And Sal, thank you yet again for being here today.
Thank you, everyone. And thank you, Grant.
Thank you, guys.